Welcome, everybody, to another exciting Woo University event. I will say that this event is the one I have been looking forward to the most out of the entire year, out of all the Woo University events we've done, and we've had so many incredible events, but I am so excited for this one. If anybody knows me, I love wine. I am a sommelier, as well as Dr. Karpecki, who is on the line as well, who's going to be giving this amazing presentation. And I am just so thrilled to be here tonight with you all. My name is Stephanie Woo, and I am the founder of Woo University and your host for this evening. And now it's my pleasure to introduce tonight's speaker, Dr. Paul Karpecki. Dr. Karpecki received his Doctor of Optometry degree from Indiana University and completed a Dury Fellowship in Medical Cornea and Refractive Surgery in Kansas City in affiliation with the Pennsylvania College of Optometry. He currently serves as a Director of Cornea and External Disease for the Kentucky Eye Institute in Lexington, Kentucky. He is the Chief Editor for the Review of Optometry, the most read journal in the profession, and he's also the Medical Director for Kepler Vision. On top of all of Dr. Karpecki's accolades and all of his accomplishments, I will say that out of all of the eye care professionals that I work with in the industry, Paul is one of the most inspirational and influential doctors that I have ever met. He is incredibly intelligent, and he's just such a wonderful person. And I'm so grateful that he's here for the Woo University event. I can't thank you enough, Dr. Karpecki. I'm so excited. I have my wine ready to go for your presentation.
Thank you, Stephanie. That's a great introduction. I'm blessed that we have the friendship we have, and honored to get to do this. I mean, who wouldn't want to be able to do a presentation involving wine for co-credit? It is just 1 hour co-credit. That's what I certified. I co-approved on this one, but it's kind of a fun hour. Goes through pretty quickly and gets you a chance to kind of try different things. I, however, my hair's probably still sticking out, was putting my son to bed, and normally he's out by about 8. He just turned 8 day before yesterday. So I had to rush down. I'm gonna have to pour my wine during this event somehow to kind of get you started on some of the things related to it. I do have my handwritten. This is one of my favorite wineries there is. So it's interesting they mentioned I did a Dury Fellowship because one of the owners of this winery did a Dury Fellowship, Vance Thompson, the same one. His, of course, was more ophthalmology, surgical based. Mine was all medical cornea based. I mean, we did the same thing other than they did surgery and I did more medical. I was seeing patients all 6 days of the week or 5.5. But amazingly, this is a winery he's part of. He obviously did much better than I did coming out of a fellowship because he owns a winery. I just get to drink them. But I'm going to take you through, here's my consulting arrangements that shouldn't apply, but I want to put them all up for full disclosure. Companies I do research with, consulting, advisory boards, etc. So just a couple pages. So this is really the more important stuff here, getting into wine and ocular health. And we do have to make this a very balanced presentation. So I did practice, Stephanie mentioned, and Stephanie is just one of my favorite people to get to work with on advisory boards. We were just on one Vision Expo, and she was so always impressive, and once again was. But now we get to share kind of this wine love. She's, I think, also part of the Master Court of Sommeliers. I'm a third level sommelier in that. Next level is wine master, but I don't really work in the industry, so I think I can't even sit for that. But it's been fun going along the process and learning. So let's get into understanding wine, what we're going to talk about today for the next 50 minutes, or now about 46 minutes. Ocular health benefits, general health benefits, and then we're balancing it out with the risk of excessive drinking. I know the last one has to balance it out. It is COPE credit, so we have to have balanced education, and that's what this will be. We'll take you through. It's kind of like if you had a glass or two of wine a night, you should be overall experiencing health benefits. But if you decided you'd have a bottle or two a night, you're not. You're going to go the other way very quickly. So risks of excessive drinking and risks of benefits are all in moderation and proper amounts. So I guess a good place to start is the French paradox. If we're looking into a little bit of the science, because I think that's what got people into the idea of, processing what is going on and why is wine out there? And the French paradox really came out about 40 years ago. I think today, if you looked at the French paradox, it doesn't really apply because the American diet isn't the healthiest diet in the country. But in the world, I should say. But back then, the French paradox involved the fact that people in France ate much heavier foods 40 years ago, 30 years ago. A lot of creams, a lot of meats in their diet, et cetera. And they had a longer life expectancy by about 6 or 7 years. They also seemed to develop cataracts later in life. At least that was thought to be the case. Now, new research has actually shown it is the case. And John, nice comment. His balanced presentation, including red and white wines. I love that. That's balanced. Yes, indeed it is. We're not balanced today. We're going to do 2 reds, a Pinot Noir and a Cabernet, but I would say these are my 2 favorite choices from this winery, although they make so many good wines. In this, it's really funny when you look at these studies, like when you look at eye studies, you get like 40 patients. That's a big study, maybe 20. When you do studies with wine, you get 1,045 people showing up. So in this study, they compared photofluorometry, meaning they did, light reflection, light scatter, so to speak, looking at the density changes in cataracts. And they just went through a whole bunch of patients that were anywhere from about age 50 to 65, I think was the range, or 45 to 65, there it is. And they looked at the amount of cataract density. So it was a very objective measurement in 1,045 patients. And sure enough, people who said they drank a moderate level of wine consumption, they said they drank an excessive, they weren't in the study. So we don't even know about that group, probably more cataracts. But those who said a moderate amount, was 1 to 3, no more glasses than that typically per night, 22% of them had significant density changes of cataracts. 32%, almost a 50% greater number of people who said they never drank wine in terms of the cataracts. And so there may be something to this as well. This was presented in Europe. It was a 5-year study and a large patient population, kind of like we look at the Blue Mountain group or the any of those kind of groups. Specifically, this is the Regenerative Eye group. It was published in Arvo 2005 as a poster. And sure enough, the protective effect of wine intake on 5-year incidence of cataract development. 22% of those who drank red wine moderately, and 32% of those who didn't had cataracts. Of this, again, look at this study, 3,072 people volunteered for a study involving probably free wine. 45 to 74 years of age with macular changes indicative of AMD. And what they did is they looked at the overall statistics in these patients who had macular degeneration. They found that those who drank a moderate consumption of wine had the inverse relationship, a lot less AMD, statistical to less than 0.01, meaning 99.99% likelihood. It wasn't random, wasn't by chance. What was interesting, though, is they did not see a benefit in AMD to people who drank beer or hard liquor like bourbon in Kentucky, sadly, on a regular basis. But it really did show a significance when it came to wine. Any benefits, Roger, Roger Wu, another good friend I've worked with many years, any benefit of drinking a whole bottle of 2007 Insignia, one of my all-time favorite wines? A bottle, probably we're losing it, but one night of a bottle, I think you're okay. If you did it continuously, Roger, maybe not, but I'm going to test your theory. Maybe we can get together and do that one day. I have severe allergy to wine, flushing, stuffy nose, throat, and itchy eyes. I guess it's sulfites. Love this question. Thank you for asking this. We always used to think it was sulfites. At least that was kind of the key. But the problem is that all wines produce some level of sulfites naturally during the fermentation, but it showed that they did some research on this. So we get back to science where they looked at those with low levels versus higher levels. They really didn't see it being the key link. There was some component there, but it wasn't what they thought was causing that allergy component. When they analyzed especially heavier red wines, they recognize there's a lot more histamine release that occurs in a red wine. We believe that's why we see the allergy to wines, where you get a stuffy nose, throat, itchy eyes. And so the wines to drink to decrease those effects are kind of unique ones. A Pinot Noir might have less if you're going to do red. Charbono, very rare wine, but we'll do that. Certainly if you looked at the whites, you get a less potential of it. Perhaps it's not so much the sulfites, but it is somewhat fermentation. Maybe avoid the oak to be on the safe side, because that can play a role too. So maybe an unoaked Chardonnay, or maybe a lighter type wine that doesn't get a lot of that, like a Sauvignon Blanc out of perhaps the New World would work as an option. So those are worth trying as opposed to the big heavy reds like your Barolos and your Merlot and your Cabernet Sauvignon and Cabernet Franc. I'd move towards the lighter reds or even towards a white for sure. Does the redness of wine correspond to the amount of flavonoids? What a great question, Tim, because we're going to get into that here in a moment. So wine's really great benefit. And the number one flavonoid, it's like you knew the next slide was coming, Timothy, is resveratrol. Resveratrol can be consumed as a supplement. So I want to balance the lecture by saying you don't have to drink wine. And if you're someone who has allergies to the histamine release in wines, you can still get the benefits of resveratrol through a supplement. And in fact, the supplement probably gets you more than you can get by drinking wine. And it's a phytoestrogen flavonoid, as you said. That's exactly what it is. It's been shown to fight inflammation, prevent oxidation of certain cells, and prevent apoptosis, which you all know is a programmed time of cell death. So you can allow the cell to live its full life or longer. And that's what resveratrol has been shown to do. And we're going to revisit resveratrol, but because that question came up, luckily the next slide hit the most common flavonoid. Here's a cool study on cataracts that ties in. So the last study on resveratrol was pointing to why we think there's less AMD. So it was actually tied into the previous study here, this AMD study, where we had significantly less macular degeneration in patients who drank moderate wine. And we believe it's resveratrol is the key ingredient. Although there's a lot of flavonoids we're going to cover, that's probably the number one. Let's go back to cataracts. In this study, they took, of course, these are rat models, but what they did is they did a subcutaneous injection of something called selenite, immediate induction of a cataract when you induce that into the system. So the rats were either injected with normal saline as a control, sodium selenite alone, or sodium selenite after ingesting 40 milligrams per kilogram of resveratrol. Now, let's put that in context. That would be like drinking 20 bottles of wine without the alcohol. Pretty hard to do. But so it's a very extreme level. But nevertheless, hey, it's still, resveratrol, which we just introduced. And then they looked at cataract development in this group, analyzed for lipid peroxidation, inducing it. And the results were fascinating. So the results of those rats that got the sodium selenite, 100% of them developed cataracts, and they all were rated by fluorophotometry as being 3, 4, 5, or 6. 6 being completely dense, or most advanced, wet, ripe, whatever you want to call cataract to the highest level, mature cataract. And that was the injection. Those who got saline, nothing happened to the lens, as you would expect. Well, what happened to the group that got the resveratrol beforehand and then got the exact same selenite injection? That's the group 3. Well, what was interesting of this group, 7 of the 60 animals showed 0% cataract development, which is amazing. None, even though they had the same injection where the other ones had 100% cataract, the ones who didn't get the resveratrol. And the remaining 9 were all graded at 3 or less, so not statistical cataracts. And that was overall statistical to 0.05, even in a very small rat population. So pretty interesting study. Ocular benefits of drinking. Oh, I love that. Does the redness of the rind? It does correspond to the flavonoids, and it does correspond particularly to that. Actually, it does. It is truly the flavonoids, the phytoestrogens that cause the color that's there. And that's why red wines have more than the other that are present. So I love those comments. All right, here's a study that looked at AMD again. I apologize for jumping from AMD into cataracts back to AMD, but they seemed to flow better when we were introducing the first one, or maybe that was after I drank too much wine. But antioxidants and antiproliferative effects of resveratrol were examined in a human RPE cell line. So they took our retinal pigment epithelium. So the last study was animals. Here's a rumen. It's not a human eye, but human retinal pigment epithelial cell line, which you can keep growing. And the results show that treatment with 50 and 100 micromoles per liter of resveratrol significantly reduced proliferation by 10 and 25% respectively. So it's been shown to inhibit oxidation, protect RPE cells, to prevent death, and thus likely, as the first study showed in humans, decrease the likelihood of developing macular degeneration. So it makes sense when you start to understand what's going on. The reduction in cell proliferation, they believe, was caused by inhibition of an enzyme that causes damage known as protein kinase. And you'll see this brought up a lot in various studies where they even look at anti-VEGF. So protein kinase is shown to be inhibited specifically by resveratrol in as low of a concentration as 5 micromoles per liter, which is really about 1/5 to 1/3 of a glass of wine. So even that small amount will inhibit your protein kinases and go a long ways, perhaps, to preventing macular degeneration in the long run. The results are that it can reduce oxidative stress, prevents hyperproliferation of the RPE cells of the retina, and therefore, hopefully, decreases the potential of macular degeneration. In one paper, they found the combination of grapeseed, proanthocyanidine, which are tannins. Okay, so get your wines. Well, got an early wine. We're going to start with a light one here. And I'm going to have to grab a wine opener as we do this, but I want you to take a look. The first key when you get a wine, and we're going to go into this much more later when we got AJ and Stephanie with us. But first thing when you get a wine handed to you at a restaurant is to look at what? Is to look at the color, just to make sure the color is the right color. In other words, all wines kind of go towards brown. You know, they may start out, you know, as very garnet or even purple, and then they move to red, then they move to kind of a, you know, brick orange eventually, and then on to brown. So if you had a wine that was 5 years old, you wouldn't expect it to be brick orange. You expect it to be vibrant in color. And likewise, if you white wines start, you know, white and even clear, and then move towards brown in time, maybe kind of yellow, golden brown, and then eventually go, you know, to that color. So we want to look at the color first. You want to look at the rim, your Pinot Noir, which we're going to try together here in a moment, a little while after this, all together, not during the lecture, but right afterwards. You want to look at the edge of the rim. So remember these things when we get to that. They'll show you the lighter color because, you know, the skins of Pinot Noir are much thinner. They do still impart the color you need, but to a lighter degree than some of the bigger grape skin colors like well, it could get really big, you know, in terms of some of them that are present, like your Zinfandels, your Cabs, your Merlot, etc., and certainly even Petit Syrah can have a very small, concentrated, thick skin. So it just depends on the grape that's present. But nevertheless, that's the tannins. Now, if you want to really check tannins, we're going to get into the second part of wine tasting a little bit later. But you want to check into your tannins. You should take a little of the wine. This will be for your big cab tonight. And I like to put it in my front gums here. Just place a little in here, and I want to see how much it grips. That tells me about the wine. Is it still too young and it's gripping and still too tannic? Maybe I need to decant it. Is it non-present? There's no tannins. Maybe it's at the end of its cycle if it's a big cab, and there shouldn't be as many tannins in other lighter type wines. Pinot Noir can be in the middle depending on the quality that's there as well. What temperature we get our cab and Pinot for drinking tonight? I've heard 57. Good question. My cellar's at 57, 56 actually for maintaining it. I do like my whites a little on the cooler side, but not cold. That's one of my pet peeves. A cold wine. I mean, if you have a really bad wine and you have guests over and you don't want them to know it's bad, just chill it. The acidity takes over and they can't really tell how bad it is. But that's not really a fair thing to do. But it tells you why you wouldn't want an over-chilled good wine. You'll take away from so many of the great flavors. So I like my whites somewhere around 63 to 65, even a really good high quality white wine. I'd bring it up to 65 to 66. You know, 70 is too warm for any wine. That's, you know, room temperature. Back when they called it room temperature was in the caves. You know, so a room temperature should be 60 to 65 as an ideal temperature. And even reds would be at the upper end, 65, 66. Whites could be maybe in your mid to low 60s, but I kind of like them in that range. So if you've got them at 57, go ahead and take it out for the next 20 minutes. That'll get it to the perfect temperature. And if it's a red wine, you know, you can drink the white a little sooner than the red later. I like my Pinots a little cooler, but not too much cooler. And I like my reds a little warmer, but not warm, if that makes sense. So no 70-degree wines. A warm red wine just really lets us down a lot. Good. Perfect questions. All right. So there's another interesting thing. We just showed dry AMD. There's also a study on wet AMD, endothelial growth factor, VEGF expression, and found that the tannins, the proanthocyanidins in particular, your flavonoids, may help as a natural anti-VEGF as the basis of, and of course, we know that's the basis of our current for wet AMD today. What about the cornea? I'm a cornea guy. So where does that come in? Well, resveratrol in particular, and we're going to talk about all the flavonoids, has the ability to suppress the enzyme matrix metalloproteinase. Can you think of conditions, and you could put it in the chat area, conditions where MMP9s, conditions of the eye, where MMP9s are elevated? Any answers? Okay, dry eye, very good. Dry eye is definitely elevated. MGD, right on. Meibomian gland dysfunction. Good. You know, interesting, there's some that you wouldn't expect. Keratoconus has a really high level. Recurrent erosion is perhaps the highest of them all. So whoever put down recurrent erosion, which we got a lot of people, EBMD with RCE, that's it. All are high, dry eye, MGD, but RCE seems to be one of the highest. And we believe that's why MMP9 will cleave the little hemidesmosome, so you can't regrip the basement membrane with the epithelial cells, and thus you do get recurrent erosion. So those recalcitrant, those treatment-resistant ones are probably more caused by MMP9. That's why if you took a person who had recurrent erosion or recalcitrant form, and you put them on steroids for about 6 to 8 weeks and maybe low-dose doxy, plus you want to get the edema out, so Muro at night, maybe fresh coat during the day, you should find, amazingly, that you can heal about 83% of those patients. Those are non-responsive. In fact, they believe the reason why amniotic membrane works for RCE patients is the inhibition of MMP9 as well. So when it's first early and the first time you've ever had an RCE, then you're probably just dealing with just the edema, and you want to get that down with your Muros and your sodium chlorides. But longer term, it's MMP based. And so you really have to suppress that. And the only thing we know of that really suppresses MMPs are steroids and oral tetracyclines. But you're exactly right. RCE was the big factor here. Also with resveratrol, we've also seen the ability of it to reduce corneal neovascularization. So here's a patient that recently presented in my office with recurrent corneal erosion. You could see the inverse patterns in the cornea. You know, this person had numerous breakdowns. So either I would do an amniotic membrane on this right away, just to debride the loose epithelium gently with a Wexel sponge or something like that. If it's EBMD, you might have to use your spatula, but for just a little, that area, I would just kind of gently clean it up at the edges, put the amnion on, or use the cocktail, or kind of your topical steroids, BID for 2 months, checking pressures in the middle. Low dose, 20 or 50 milligrams of doxy BID for 2 months. Muro ointment every night, and if they need a drop during the day, fresh coat doesn't tend to cause much edema, tends to pull out some. So there's your perfect cocktail with an 83% success rate. And then, of course, tell them to drink 1 or 2 glasses of red wine each night for 6 to 8 weeks. Okay, so here it is, what we just talked about: Muro, fresh coat, Lotomax. We actually studied this protocol about 11 years ago and found that in patients where nothing had worked for them, we had an 83% success rate over 6 months, meaning no recurrent erosion for 6 solid months after the treatment. So 8 months really, because 2 months of treatment and 6 more months. I don't know if they started breaking down again after that. We had to do the study in 6 months. Cryopreserved is another really good option that has been shown to really work well. I mean, it's really like fitting a contact lens. You place the amnion in an anesthetized eye under the upper eyelid, then under the lower eyelid. There's dehydrated forms, maybe not as much of the potential, but they do have still MMP inhibition. So they can work in this case as well. This one you place under a bandaged lens, or what I've been doing on some patients where it hasn't been a severe case is I will put in topical anesthesia on the cornea, place the dry form, as you see here, over top. This is a patient with some neovascularization inferiorly and an epi defect. I'll just place it on top. Those are Bruder dry amnion forceps that really help out. And then you just either put a bandaged lens over top, or what I like to do is something that's not even on the market yet. I know you should be talking about stuff you can't even get, but Doug DeVries worked on these seals, and I did some research with him, and I absolutely love these things. They stay on. They have a little tab for removing. I use them for non-lid closure in patients whose eyes have a little bit of opening at nighttime. And I've just had wonderful success with that. But look at how many nutrients and growth factors exist. Now, the cryopreserved Procara has a wonderful array of them, including pentaxin. But this is the Atlas form, which is a dry form, and it has a number of also great growth factors. I don't know if all the dry forms have this much, but this one does too. So those tend to be kind of a good option. It's the only ones that I've seen sound research showing the components have been Procara cryopreserved and Atlas dry forms. And look at all, this is the dry. Those growth factors will inhibit MMP9s and get them to a next level. Now, if you're still breaking down, think about vitamin C. And even they showed a study that showed that patients who, it was a Canadian study, so my friends like Bruce Litkey, a good friend and classmate up in Canada who's on, this was a Canadian study where they took PRK patients and give them 1,000 milligrams of vitamin C, and they statistically healed faster than those who didn't get the vitamin C. Well, you're going to get a lot of those vitamins in wine too. So that would have been your other option, might have been more enjoyable. So let's go into something called black currant, also known as cassis. When we're drinking our big Cabernet tonight from Handwritten, again, one of my favorite wineries, you are going to find a good amount of cassis in this one. That's a flavor that we're not familiar with because we don't typically pick black currants here in the US or in Canada, but in in Europe, they do. And I've had actually blackcurrant jelly and blackcurrant jam. I just bought it because I wanted to see what it really tasted like, solely for wine purposes, not for the jelly or jam itself. And amazingly, it does have a lot of those same flavors you get in red wine and those same nuances that are present. It's a source of malvidin, which is an anthocyanin, another one of the flavonoids that causes the color. Someone asked the question earlier, what causes the color? One of the key ingredients for color is actually malvidin, although resveratrol is another one of these, phytoestrogens. Malvidin in particular and the other anthocyanins are what cause that deep color pigmentation and also that cassis flavor. The seeds of blackcurrant also deliver something known as gamma-linolenic acid. Gamma-linolenic acid has been shown to be more powerful than fish oil, but usually you combine it with fish oil so that you get a very anti-inflammatory effect from the GLA, like magnified. It's kind of like wine. You can get a lot of the same benefits from grape juice, but it's 400% higher in fermented grapes. So I don't want to steer you saying you got to drink wine. That's not what we're trying to say in this lecture, but you do get a lot more effect. Just like GLA is the most powerful that we know of based on these studies for PGE1 inhibition in dry eye, but it's only really effective when combined with some fish oil, not a lot. So that is where these kind of fit in. So again, can you repeat what MMP9 does at the level of the membrane? Wonderful question. So what happens at the level, MMP9s have been shown in a study by Durson to cleave the feet of the basement, the feet of the hemidesmosomes, what they are. And for some reason, it just cuts them. And the high presence of them has that ability. So it makes it very difficult for the epithelium basement membrane to lock in, and it continues to break it down. So by inhibiting MMP9, steroids, doxycycline, educating patients on risks of sunburn and that with doxycycline, you can inhibit enough to allow that area to heal. And for those, essentially for the feet of the epithelium to the hemidesmosomes to reattach. Now, it takes 6 to 8 weeks for full reattachment. So that means you got to drink your wine every day. No, you got to take your anti-inflammatories every day to be able to get that controlled. So 6 weeks minimum, 8 weeks ideal for recalcitrant cases. And I've seen that. I've seen a doc send a patient over to me for recurrent erosion. I looked at the list that are on doxy, steroids, topical, fresh coat drops, thinking, wow, they really know their stuff, and mural ointment, and they're breaking down. And I said, well, you know what? Back then we didn't have amnion. I was saying, that's kind of what I use. So I'm not so sure what we're going to do. Maybe we'll just scrape your epithelium. And then I looked in chart, realized, I said, how long does your doctor keep you on that combination? And said about 3 weeks, everything's perfect. And then we come off of it, it breaks down again. I said, the doctor is amazing that they knew this because the study had just barely been published, but you have to have 6 to 8 weeks. We went ahead and did 8 weeks, completely cleared, never came back. So time is also critical. So here's what I decided to look at, where this was a paper I had written many years ago in review for one of the reviews of understanding omega fatty acids in ocular surface disease, particularly dry eyes. And I didn't know about GLA back then. I started doing this research and GLA kept coming up and coming up. Well, what is this GLA stuff? And it found 7 different studies where there was only at the time 1 fish oil study. Now there's 3, and 1 didn't show benefit, but it's because of the way the study was designed. But there was a study on GLA for aqueous deficient dry eye that was successful, PRK successful, Sjogren's, contact lens wear time, meibomian gland dysfunction, mild to moderate DE, and postmenopausal women. The only product that has a high concentration of GLA with fish oil is, of course, Hydro Eye. That was the name of that last study. But it's more compelling evidence versus fish oil alone. And perhaps that was the really big difference in kind of some of the studies that didn't show a fish oil to have that much of a separation from the placebo. Might be that you really want to have that GLA with it. It's specifically for dry eye though. Like if a person's on Lavazza for their heart, I wouldn't take them off fish oil. That's helping the heart and other organs. But if it's for dry eye, GLA really is a key. GLA with fish oil, not GLA alone. Combining it with EPA, DHA is where you get your maximum effect. So Greg's got a great question. What about DHA and EPA compared to it? So you could still do DHA and EPA together, but to get the same effect, you're looking at about 3 grams. So it's a lot of big fish oil to try and get similar levels of anti-inflammatory to GLA with fish oil. That's a nice, tiny, easy to consume pill. So that's how you'd have to do it. You'd have to get a much higher level. And so, like, for example, a big guy who eats terrible, who eats no fish, who has severe dry eye disease, probably needs more than that. You're not going to get it with EPA and DHA. Petite female, mild dry eye, yeah, you could probably get away with fish oil, and you could get away with even 2 grams, in that case. So if you want what's going to get across the entire board, look for GLA with EPA, DHA. And then you don't need as much EPA, DHA. When I started switching clinically in my clinic to GLA with DHA, EPA, I will tell you 95% of the patients said they could vastly tell a difference over anything they'd been on prior. And I had a really good fish oil prior to that time. Here's some of the clinical trials that have shown what GLA can do. GLA comes from black currants, which is obviously the Malvidin component. Guess what? The Malvidin component is in red wines. So you get a lot. There is some in white wines too, especially, when it comes to omegas. White wines have a good amount of omegas themselves. So it has a significant improvement over irritation and symptoms, better control versus placebo, significantly lowers the level of irregularity of the cornea. But this is a cool study. They looked at patients taking EPA, DHA in this study. So I'm trying to balance it all out. And so this is just your pure fish oils, higher milligrams. Dr. Nixon's great question. So you're using just your EPA, DHA in this one. They found that people who drank a moderate amount of alcohol, and this one did include more than wine, but it was mainly wine consumption. They really found that it was all over the place with beer and hard liquor. But with the wine consumption, even though all were studied, their omega levels, when they measure them, were significantly higher than those who didn't drink wine with their omega-3 supplements. So perhaps if you're doing a lot and you need a lot of it, add in a little wine. And I'm being a little facetious, but the science does kind of support that to some degree. And it might explain the heart benefits conferred from drinking red wine and taking omega fatty acids as well. Antioxidants are really there to promote, are the health promoting components in wine, especially reds. Whites have some too. I don't want to negate whites. Sometimes in the summer, there's nothing better than a good white wine, but you're going to get a higher level when you use your reds, and especially vitamin C and E, which have been known to function as antioxidants. So your free radicals are those things coming in, trying to attack the cell. E tends to be a very good protectant. And of course, C is a natural antioxidant. But what VE does is it actually gives a boost to vitamin C according to the research. And that's how your antioxidants work together. It's kind of like they say, if you ate a salad and you ate just the lettuce one day and just the carrots the next day and just the radishes the next day, and kind of, you would never get as much nutrition as if you ate all of that together in one meal, even though the other one was spread over 4 or 5 days. And it's the same thing here. You get a lot more benefits from things that have multi-antioxidants in them because one can recharge the other one and allow it to rejuvenate, to become super C, as you see here, in terms of its antioxidant benefits. So wine delivers that array, like a good salad would or other good healthy nutrients, but wine to an incredible extent has all of these in it. Malvidin, gallic acid, a little bit of what we get in tannic acid. We go through some of them, but for the interest of time, I'm not going to hit them all, but these are all polyphenols. Mycertin, rutin, quercetin, you've probably heard of quercetin, CoQ, a 10 would be a good example where you can get that if you don't want to go the wine route. Camphorol, resveratrol, catechin, and epicatechin, and of course Malvidin, which gives that deep color to your wines. So this is kind of a mixed berry extract, lemon bioflavonoids, bilberry, which you would find in, there's a new study on a computer vision syndrome or digital vision syndrome study that used a supplement. Weird name, Blue Rex is what it was called. Just saw the paper on it, where it used a mixed berry extract with bilberry, green tea extract, and resveratrol. And they showed statistical improvement in terms of like 4 parameters they looked at. So there's other ways to get the benefits of wine in nutrient and nutritional supplements as well. Wine's just a little more fun if you don't have allergies or other issues related to it. So Malvidin is really where we get a lot of our pigment. So again, we talked about the importance of colors. Good question on flaxseed, primarily to women. Candace, you know your stuff. Flaxseed seems to be absorbable more in women. About 15% of it is absorbable. Men, only about 5%. So I have some patients who are vegan women. I put them on flax. They do great. It does get enough. Men don't seem to metabolize flax all that well. Pound for pound, you're going to get a lot more with GLA, with EPA, DHA. What would be the recommendation milligrams? So with milligrams, you can get away with about 180 GLA. but you're going to need somewhere around 375 to 500 EPA DHA. That doesn't sound like a lot, but it does in the presence of GLA. You can get away with like 1/5 of the EPA DHA of pure fish oil. Great questions. These are so well thought out. The cardioprotective benefits of wine. Gallic acid is the tannins. Remember, when you taste a wine, you put a little up here if it's a red wine to see if it's really got a lot of tannin. It's a really good way to understand that wine need to be aged a little more. Is it at the end? Gallic acid has been found to be beneficial in Alzheimer's and Parkinson's, be anti-carcinogenic. Mycertin is shown to be anti-carcinogenic and cardioprotective. Rutin, a little less, but it's another flavonoid that's anti-inflammatory, antioxidant. We found some studies that have helped it with diabetes and brain health. Your quercetin has been shown to be beneficial in glaucoma and cardioprotective. Camphorol is another flavonoid that's been shown to benefit patients who have diabetes and even in terms of decreased cancer risk. Resveratrol, we already covered extensively. Catechin, which is a flavonoid in dark chocolate. So you can that's another way of getting really good flavonoids would be got to be above about 75, 72 in your chocolate count. But, you still get some at that. Above 80, you get a lot. And then malvidin, again, which we talked about, colors things ahead of time. Bruce is going to go through scientific literature to justify his scotch drinking. I love it. That's kind of why I did this course. So wine antioxidants like quercetin, CoQ10, other ingredients like that can certainly play a role. Sorry, I'm going to speed past this, but there is some neuroprotective studies that have been found. Resveratrol. I do have to look a little bit at this study because what's interesting about this one is that even moderate doses, which are found in all forms, the wines that have the highest level of resveratrol? In all of wines, you'd think, it's got to be a big, big wine. Well, actually, Pinot Noir. Pinot Noir tends to, and if someone really knows their wine, they're going to say, actually, Carmenere is higher, Dr. Karpecki. And they're right. Carmenere, in a study, has slightly more resveratrol, but Pinot Noir is right there statistically the same. So Pinot Noir is a pretty nice choice as a whole. Grape wine extract has plenty of resveratrol in terms of it's worked in studies on patients with diabetes, hypertension, coronary artery disease. Mycertin has been done in diabetes as well, as we talked about. It improved glucose and glycogen metabolism, lowers hypoglycemia counts. In one study, it was shown to decrease counts by more than 50% and normalize elevated triglyceride levels. I had a great question earlier. Let me see if I could find it. Looking at Brunello di Montepulciano. So we're going to get into the region of Tuscany with this question, where they had read. Let me see if I could find the doctor who asked this terrific question. I can't find it, darn it. Anyways, maybe it's in the chat area, not in Q&A, that had said they thought that it helped with HDLs and lowering LDLs, which is, exactly what you want to have. And the answer is yes. There has been a number of studies involving mycertin. Sangiovese, the primary grape in a Tuscan wine like Brunello, has a lot of mycertin as well. And yes, it will help elevate proper triglycerides, the HDLs, while lowering the LDLs and improve normal renal function. So yes, the person who read that is true and is spot on in that regards. So diabetes, patients with typical finding. And when you combine ingredients, you get naturally a greater effect. As we talked about in this study, they found that the combination of quercetin with mycertin helped with RPE cells in an animal study. So they were able to show a decreased potential risk of moving to wet AMD. All right, why do we get the redness? We talked about malvidin and other flavonoids that are present. Remember that wines as they age go from bright colors like purple and very clear and whitish yellow down towards brown. So a young wine shouldn't have that color. What it's doing is it's actually destabilizing a little. Doesn't mean the wine's bad. Only about 1 to 3% of wines are age-worthy, though. Very small percentage that are out there. One study looked at tannins specifically. We talked about how to look for tannins and where and first of all, here's the question in the chat group. Where do tannins come from? Does anybody know? There's 4 sources of tannins, which help us to understand why you still can get tannins and some benefits in white wine. All right, let's see what we've got for our answers. That's good. Yeah, that's a good point, Jeremy. Algae oil supplements have higher concentration of EPA, DHA, more similar to fish as opposed to flax. You're right. Yeah, I've really kind of would put almost GLA first combinations, followed by probably your algae sources, then your fish oils in terms of where you're at. All beneficial though, all very beneficial. The skins absolutely will do that. Skins will impart a lot of tannin and some of those benefits we talked about. The seeds, the stems, which all get thrown in there in maceration and processing. And believe it or not, even the oak, if you should oak a wine, which we're going to hear about today from AJ, you can also get some transfer of resveratrol, of your tannins into that, and obviously the components, the polyphenols that we talked about. So the oaks are also important in the source of tannins, distinct from those provided by the grape skins and seeds and stems. They give that parched effect to know that a wine can age a little bit longer. It can be bitter if you don't drink it properly. So when you're drinking wine, and we're going to finish with smell because that's the most important thing. When you're drinking wine, you have to cover your entire tongue. If you take the wine and throw it back, the tannins will, remember what taste buds are at the back of your tongue? Does anybody know? Our bitter taste buds, right? So if you decide you're going to chug back your wine or just shoot it back, the tannins will tell you that this was a very bitter wine. So back when I was in early college, I probably didn't drink properly and probably shot it back. And boy, it tasted pretty bitter. So you really want to make sure you cover the front of your tongue, which is your sweet taste buds. And what's on the sides? Your acidity taste buds that help you to know, they make you feel like you're salivating. You got to cover them all to be able to get to a really good point. What fish oil with JLA have you been using? I've recently been using, or not recent, it's been 7 years, Hydro-Eye, because I studied it and found it was beneficial over what I'd had and did work well. That's the name of it. Oak barrels do impart, as we talked about, get your entire tongue when you're tasting the wine tonight. Here's a really cool thing. Could wines be the fountain of youth, and resveratrol in particular? Well, in this study, same sort of study as before, these fortunate mice, because they live 33% longer, were ingesting more resveratrol than you could drink in a week. I mean, so it's not real world, but hey, it is a study on resveratrol, and it found that the mice who were on resveratrol actually lived 33% longer than the mice who did not get resveratrol supplement. And maybe it wasn't that extreme of amount, but it would have been equivalent to like 2 bottles a night. And there's no benefit to 2 bottles of wine because the alcohol offsets all your benefits. So it'd be the same as drinking 2 bottles of really alcohol-free wine, which you can't get because the fermentation creates the resveratrol and all the components in it. But nevertheless, it is more than normal, but it did show 33% longer life in the mice who were given resveratrol supplements. Now let's balance things out. Too much wine, just the opposite. There's been studies showing that accidents and death increase highly statistically with alcohol consumption. Hence the very significant laws against drinking and driving. But there's tons of more, not only is there higher accident rates, but there's higher mortality rates. There's higher mortality per capita consumption. There's also higher mortality per amount of alcohol consumed when it comes to accidents. It's been linked with increased heart disease, ischemic heart disease in particular. Consumption levels are directly proportional to mortality rates. So someone who drank 5 bottles a day would have a much lower life expectancy than someone who drank 1. Both would be bad if that's what they drank every night. So it really is harmful effects. Liver damage or cirrhosis has been shown to be a major damaging effect of excessive wine. And because the liver really doesn't have any pain receptors, you can really be in trouble with damage to that over time. And the studies have shown that liver cirrhosis is the activation of hepatic stellate cells. Hepatic stellate cells are activated by things like overuse and alcohol. So it requires microfibroblasts-like phenotypes that are present in hard liquors, but also wine and beer in excess. Phenolinic compounds contained in red wine have been shown to have antifibrotic properties in small to moderate amounts. So you actually get benefits perhaps to the hepatic cells, but in large amounts it activates the hepatic stellate cells, resulting in cirrhosis. So studies have actually broken down the balance of wine to damage of the liver. Epidemiological data also has identified chronic excessive alcohol consumption as being a factor in respiratory tract cancers, GI cancers, esophageal cancers, liver, breast, and colorectal cancers. And all of those have a statistically greater amount. They believe the pathophysiological mechanism of that is something called a reactive aldehyde species, or acetaldehyde. It's a free radical damage. That's why it's a reactive aldehyde species. What's really cool is there's a drug from a company called Aldira in phase 3, completed phase 3, meeting its endpoint for both allergic conjunctivitis and dry eye disease. Both conditions have high reactive aldehyde species levels, and really some of the best data I've seen from a dry eye drug. And it works like a steroid without side effects based on what I saw in the phase 3 trials. Now, I'd love to see a comparison to steroids. I think it's going to show it to be very close in terms of its power as far as an anti-inflammatory. That drug's likely to be approved in late 2022, early 2023. So it's about a year away. Finally, 1 to 2 glasses per day, likely beneficial. 1 to 2 bottles per day, not going to do well for you. As you just saw, excess wine had way more negative effects than moderate wine beneficial effects. But there's a lot of beneficial effects, don't get me wrong, to moderate wine consumption, but large consumption has way more detrimental effects. Last thing is, how do you know what to do in smelling a wine? And then we'll take 4 minutes of questions. That's the most important thing, is your smell. And we're going to get into that. When you look at the wine and you looked at the color to see if it wasn't brown for a young wine. Now, if it's a 20, 30-year-old wine, well-aged, a little bit towards brown is normal. We don't want to see a little brick orange. There are exceptions. The Nebbiolo grape, which are your Barolos, your Barbarescos, do take on an orange hue fairly early in their lifespan, even as soon as 5 to 7 years. But that's specific to the Nebbiolo grape. All other wines tend to go to that color over a longer period of time, or if they're really poorly kept, or they've been oxidated, or something has damaged them. So the most important thing about a wine when you receive it is the nose. And then the nose really is to make sure whether you put your nose in it, whether you just sniff on it, however you want to be able to capture some of that. You're looking for, there's 3 smells you never want to smell in a wine. That means you got to send it back. And what are those, one of those 3 smells that tell you this wine needs to be sent back? And you can put it in the chat area if you want. And this is a good question, because sometimes there's off-putting smells that are normal. Like, for example, a really good Riesling sometimes will have a petrol, gasoline kind of smell to it. And that's actually something you'd want in a really good Riesling. A Grey Sancerre, Loire Valley, especially one that has little age-worthy capabilities, can smell like cat urine. And believe it or not, that's considered a normal scent in there. Some people call it gooseberry to make it sound better, but it smells like cat urine to me. So, those are things. So what do you want to avoid? A wet mouse. Very good, Paul. Anything that's vinegar, wet newspaper, damp basement. Oh, you guys are good. So that's considered what's called a corked wine. When you get that damp basement, wet mouse, I like it. You guys are good. Oh, wet mouse, wet newspaper, great example. That's a wine where TCH has been delivered into the wine. It's a taint that gets into the cork, and then during the process gets into the wine. And if you're not sure, I was at a restaurant, I haven't had one for a while, but a few years ago, and it was a great wine. The sommelier was so thrilled by it. Someone else brought it over though, and I smelled it, and I said, I think that's corked. And he said, impossible, this is our warehouse wine. It was a second growth of Chateau Montrose, I think. And they're excited. And I said, let me just put it aside and I'll make sure. If it really is corked, like a wet mouse or wet newspaper, it only gets worse over 10 minutes. So the wine master smelly said, I do not believe that is bad, sir. And with all due respect. I said, let's set it here for a few minutes. I could be wrong. 10 minutes later, you wouldn't even want to put your nose in that. And he's like, oh, sir, my apologies. My apologies. Went out and they got it. So if you're not sure, if it's not right, let it sit a little longer. You can't miss it if it's corked. The longer it gets oxidized, the faster that smell comes through. Second is acetic acid or vinegar. Brilliant. That's exactly right, John. That means that your wine has really been spoiled. And the last one, mossy. That's a good description. Kind of think of a rotten green pepper, something like that. And that's rare anymore today, but in past years you would get that on occasion where the grapes just weren't ripened enough or spoiled upon making fermentation. You rarely ever see that. So really the big ones to look for in a wine list are mainly the cork. That's good. So those 3 aside, everything else is kind of normal. And really when what you're doing in the nose is you're kind of looking for, what are the nose notes that come out? What are the berries? What's the cassis? What things come out in the reds versus others? And there's no wrong answer. It's kind of like what you pick up. I mean, I get tropical fruit and citrus and grapefruit in Sauvignon Blancs many times. And then of course I get cassis. Pinot Noirs give me a lot of cherry notes. And so you kind of find things in dark berry notes, but it's kind of fun figuring out what's there, learning from it, knowing what to send back as well. I got a question on decanting. 3 times I decant, and we'll get into with the experts who, along with me, can go through this even better. But let me answer that real quickly. First thing is, if you have a really young wine and you're saying, okay, this thing is just not ready. The tannins were way too strong in my inner gums. I'm going to put it in a decanter, oxidize it a little. It'll soften the tannins. Now you may need an hour in the decanter or longer, but that's going to help. Number 2, a really old wine that's full of sediment, and you just don't want to drink that sediment. It's kind of off-putting when it's stuck in your teeth, and so it could be bitter in cases. So you want to pour that off. And then the last one, it just looks cool. I mean, I've had people over and let's just decant it. And they're like, why'd you decant it? I don't know. It just looked good. So sometimes you can do it just for that. But the fact is that you can't mix them. I was at this great individual he's an ophthalmologist in Indianapolis, owned a wine distributorship. He's probably not on the call, so I can talk about this. He sold his distributorship. He kept all of his first growths out of France. He had 5 of them, all of them. Not a Petrus, not on the right bank, but all the left banks. He had a Decam, which is a super first growth, and he knew he had to go into surgery that day. So at 6 a.m, he opened them all up. They went back from 1940s, 1950s, opened them all up, put them in decanters, was gone for 12 hours doing surgery. We all got to his house about 7:30 that night, and every one of them was ruined because they were fragile. They didn't, if they were brand new and they needed to be decanted for the day, that's different, like a 3-year-old, 5-year-old wine. These were just to get the sediment off. So you decant it and then you drink it right away. It was really unfortunate, except for the decam. Everything else was pretty much, well, completely gone, to be honest. But I'm sure you'll learn. And but anyways, let's go back. Ocular benefits: retinal disease, cataract, corneal disease, recurrent erosion, anti-VEGF. French paradox tells us French do well. But you know what's interesting about the French paradox when they looked at that study? It wasn't just that they drank more wine. They also walk a lot. They walked everywhere. They got a lot of exercise, and they drank in moderation. Excessive alcohol has very negative. We got to pick that up on patients. If you smell alcohol, you need to bring that up to a patient because it's not going to help any ocular disease that they have. All right.